Hi, my name is Alyssa Harley. I'm an MPH student with Big Ben AHEC.
Hi, my name is Alyssa with an I. You just met Alyssa with an Y. I'm in the MPH program at Florida State University, and I am a second-year AHEC Scholar in Leon County, Tallahassee, Florida.
Hi, my name is Rashmeet Kaur, and I am a third-year medical student at LeCom Bradenton, and I am a second-year scholar with the AHEC program in Gulf Coast Health.
Hello, my name is David Zodi. I am a student at FSU's MPH program, and I am a part of Leon County's Big Ben AHEC Scholars group.
Hello, my name is Patricia. I am an MPH student at the University of Florida, and I'm also a scholar at the AHEC Swanheeper in Gainesville.
Hi, my name is Ashley Walker. I am a student at the University of West Florida. I am currently a Scholars, a part of the Gulf Coast North AHEC program. I'm so excited to be here at this beautiful conference.
What advice would you give to a student attending their first public health conference? So my biggest piece of advice, if you're coming to your first public health conference, is definitely don't be afraid to talk to people. Everybody is here for the sake of public health. Everybody has that same passion. So while you're here in this intimate setting, definitely make those connections. Bring a resume, bring a business card, because that will be so important for your future career. If you need an internship or even just someone to bounce ideas off of, now's the time to make those connections. Why do you think opportunities like this are important for AHEC Scholars?
I think opportunities like this are important for AHEC Scholars because it gives you a vast understanding of public health. When I first came into the public health field, I didn't know how deep public health ran. I didn't know about environmental health. Also, I got pretty good trainings. I got trained for A1C testing, harm reduction training, things that people don't usually get. You know, I got to be out in the community more. I got to socialize with people, see real world life settings, be in the rural communities. I just think it's great for public health and trying to understand it.
What's one thing that you have learned here that you will take into your future career?
Yeah, so as a future healthcare professional, I think this conference has really opened my eyes. Public health surrounds us, and it's so important as a healthcare professional to understand that patients are more than just their diseases and more than just the science behind things. There's the social aspect and making sure that your patients can access the care that they need. It involves things like transportation, patient education, literacy, things like that, access to community resources. And so I hope to take that into my future and make sure that I provide holistic care and not just disease-centered care.
Have you connected with any students or professionals here at FPHA?
Yes, I've connected with other UF students who have been engaging in the same sort of thing of how do we bring in more students to be working in public health or going to public health programs, as well as various other places that give out free health resources or very useful health resources at affordable and reasonable rates. Everything here has been great. Connectivity is key. You don't have to worry about you can be a little anxious when you go up to talk to people, but like people have said before, everyone here shares the passion for public health. They might have differing topics where their passion lies, but all of the health topics here are interesting, informative, and will be extremely useful.
What has been your favorite part of FPHA so far?
For me, my favorite part was definitely connections and networking. I definitely was able to get to know a lot of different organizations and interesting things that they are doing it. Also, I was able to engage with other scholars that sometimes it's hard when you're in different units. So that was really fun too. And one thing that I will definitely take for my life, it's that there is people out there, they're still very passionate about public health. In the time that we're experiencing right now, it's hard to see light, but definitely coming to this conference gave me some energy that I didn't even notice that I was lacking.
And why do you think opportunities like attending FPHA are important for AHEC Scholars?
It's extremely important for AHEC scholars to be here at this conference. You get to be exposed to a whole range of different public health topics. You get to meet and collaborate with other fellow scholars, other students, even other people who live in different states, and you get to see what they're doing. You can collaborate, bounce off ideas with, and just see that you guys are all doing something very similar, but your system may look a little different in their system, and you guys can just learn from each other. And it's a great way to get some job opportunities, because if you are like me, a student to be graduating MPH, it's great to just have that networking and just to put yourself out there and let them know, like, hey, this is what my interests are, this is what I've been doing, this my research has been on, and just make those connections.